when we talk about depression, it's probably the greatest comorbid condition in the world, right? In terms of
Yes.
its effect on other diseases and exacerbation of symptoms and severity of disease, and it ties into causation and correlation. Um, I mean, that one kind of is well explained why we're still having an issue with the natural causes of death, but things like schizophrenia, do we have an explanation for that, or is that something that we're now considering?
Well, I mean, there are a lot of lifestyle factors associated with the schizophrenia. Like, for example, they tend to smoke more, drink more. So actually, we are now looking at combinations of these disorders and mortality, because in I mean, we know it's not new that mental disorders are highly correlated between them. So actually, when we look at the life expectancy gap for people with depression, which or other disorders are also included in this group? Because this is not a clean group of people with only depression. This is people who have a diagnosis of depression, but they might have other diagnoses. So this is also very, very important, and we have um, some preliminary results, and I hope that we will be able to publish this soon. But your point is very important. So these disorders are highly comorbid. We know that there is comorbidity within mental disorders, but also with other general medical conditions. And also one other thing I wanted to mention, that I thought when you were asking the question, is that, so here we're using registers. So we are able to identify only people with a diagnosis of depression who ended up in a psychiatric unit and got the diagnosis. So obviously this is the most severe end of the spectrum, and we cannot identify people who have been treated by the general practitioner, or people who has not been treated at all.
Wow.
For some disorders like anxiety or depression, this is very important. For some other disorders like schizophrenia, we are quite confident that we are capturing most of the patients. But for milder disorders, this is a problem.
I mean, if we're looking at this to have some kind of positive outcome in terms of understanding how much better we're tracking it, I mean, this can inform both clinical and public health decision making, right? To improve these mortality rates.
Yeah, I think so. I mean, this is a very descriptive study.
Yeah.
So we can, so from this observational data, we can't say that it's the disorder, the mental disorder, that increases your mortality. So this is just descriptive. So what we observed is that those with a diagnosis of these mental disorders die earlier or later, or whatever. So first of all, this is only descriptive. But what we can see is that, so there has been a trend in the past 20 to 22 years, and the external causes of death have been reducing. So obviously it means that there has been some good public health campaigns and improvement of services, and this have had an impact on mortality of these patients. But maybe the benefit that we saw for this type of mortality is not obvious for other types of mortality. And I'm not a clinician myself, so I cannot speak of what happens in the clinic, but maybe in some situations, patients with mental disorders are not treated as well as other patients when they have to be treated by other conditions that are not psychiatric conditions.
Okay. I mean that's still something to work with, right? At least having that laid out on the table of this is just an extra thing that we have to address in the patients, and natural cause of death. I mean, I'm not a clinician either, and I'm not sure exactly how they could address that better. But obviously, I think addressing the fact that it's so common in comorbid or chronic conditions is just is a good jumping off point. But and you mentioned obviously a lot of patients that are burdened with these diseases might turn to vices like alcohol, cigarettes, just other unhealthy habits or practices that
Yes.
that help them with that. Another chieftain concern we see, doctor, with these patients is treatment adherence. There's a lot of because of stigma and discouragement from seeking out care. It's a hard process to get them to start therapy and continue with
Yes.
it through. Do you imagine that's playing a role too in like just overall mortality?
Yeah, I mean, I guess, okay, so there are 2 points that you mentioned. The first one is about the alcohol and other that substance use. And actually, this is, of all the disorders that we looked at, this is the one that is associated with the largest reduction in life expectancy. So substance use disorders is very important when or it plays a very important role in this reduction in life expectancy in people with mental disorders. And then, yeah, from the registers, we don't have any type of data about treatment adherence. So basically, in this study, what we know is that someone received a diagnosis of a mental disorder at that point, but we don't know whether this person gets better or it doesn't, or he follows the guidelines or not. So we don't know anything about this from these hospital registers. The only thing we know is that he or she received a diagnosis of a mental disorder, and then it's when we start the follow-up. So I guess that this is very important what you mentioned, but this is not something that we can confirm from our data.
And you did mention before that you guys are doing some more follow-up and there's some preliminary results. Can you tease a little bit of what exactly you guys are seeking now and what you're hoping to find?
Yes. So as I was saying, we classified all mental disorders into 10 broad groups following the International Classification of Diseases version 10th subchapters. But it's what I was saying, that when we see a reduction in life expectancy in people with schizophrenia, how much of this reduction is explained by substance use disorders? Because we know that a large proportion of patients with the diagnosis of schizophrenia will also have some type of substance use problem. So what we are now looking is at combinations of disorders and how this affects mortality. And unfortunately, I don't have any results to share because everything is very preliminary. You know, we need to make sure that what we have is correct, and we are still reviewing all these results. But I hope they will be available soon.